problem no one wants to talk about, but many people need help with, and it's actually more common than you think.
The subject, female urinary incontinence. It's a condition that, this is a staggering statistic. 17.5 million women suffer from this every year.
Yeah, the good news is that there are methods to help women who have it, and we brought in an expert today to share some important information and an opportunity to learn more.
That's right, Dr. Phil Hoekstra. You're one of the best in the business. You're a urologist with MMPC, a member of Spectrum Health, and if someone has an issue, they should come to you, because I've known you for years and you are a fantastic doctor.
Well, thank you, Terry. I appreciate that. I think we've got an important message to get out today, and that message is that urinary incontinence is a very common problem. I'm fearful that there are many women who think it's their unique issue and that there's nothing that can be done, and that couldn't be farther from the truth.
And there are a lot of people suffering right now. We're talking 17.5 million?
Yes.
Yeah. What causes it? It's affecting so many people.
Well, one of the most common issues that leads to problems of urinary incontinence is simply pregnancy and childbirth. But there's a whole variety of other factors that can contribute to this. Sometimes it's simply a matter of fluid intake and habits. Sometimes it's a matter of medication uses. There can be other underlying disease entities that can contribute to urinary incontinence.
You have a diagram, you have a model here. Just explain a little bit about the physiology of women and how this ends up becoming a problem for us.
All right, well, let's do a little physiology and anatomy 101 here if we can. Just to orient people, this is a model of the pelvis. This structure here represents the urinary bladder, and this structure the urethra, the urine passageway. Urination occurs when the bladder contracts to expel urine through the urethra to the outside. There are three basic fundamental conditions that can aggravate urinary incontinence. One is when the bladder contracts too aggressively and forces urine out at times that you don't want it to. It's as if your bladder has a mind of its own. And that can be oftentimes treated with medication to relax the bladder. Two other conditions that relate to urinary incontinence are principally related to the urethra. One of the most common is when the urethra is not well supported. This condition occurs principally with childbirth and vaginal delivery. And this is the condition that leads to problems of urinary incontinence in the context of activity. The laugh, cough, jump, sneeze, leak. All right?
Absolutely. And it's embarrassing and inconvenient.
Exactly. And if you're a runner or do any kind of physical activity where you're pounding, it probably gets even more difficult.
Absolutely. And that condition often can be treated very successfully with a simple surgical procedure. One other condition related to the urethra that leads to poor urine control is loss of substance to the urethra. The urethra is a soft, flexible, supple tube that collapses on itself, seals shut to prevent urine leakage. One of the problems that women experience as they mature is deterioration in the substance of the urethra, and that's due to deterioration in estrogen levels.
Right. Okay. So when you do a procedure, as you had just mentioned, what is the process? What are you doing to fix the problem?
Well, what we're trying to do is reestablish normal structural support to the urethra so that it doesn't rotate out of position, it doesn't inappropriately open and allow leakage to take place. The most common surgery that we're doing today is something called sling surgery, which involves using a synthetic ribbon of mesh. It's a permanent solution to this problem, and it's highly successful.
How invasive are these surgeries?
The procedure is done typically as an outpatient procedure. It is done with sedation so that you are asleep. You don't have to be awake for this, but not deep down in general anesthesia. The process takes about 20 to 30 minutes to accomplish. It's an outpatient. You're back home that afternoon, up and down the stairs, and driving the car the next day.
Oh, that's wonderful.
Because if you suffer from this, especially a severe case of female urinary incontinence, this can be debilitating. It can keep you at home. It can trap you. You can be embarrassed to even share in normal relationships and activities.
Absolutely. It is a condition of severe social stigma, and it's a condition that women need to understand can be dealt with can be treated and can be treated successfully. One important comment that I'd like to make is it's essential to have the appropriate evaluation.
Right.
There are a variety of problems that can cause urinary incontinence, and there's no one single treatment that is effective for all of those conditions.
Well, speaking of that, you are offering people a wonderful opportunity on the 22nd of this month to ask some questions. I mean, if we've touched just the surface of it here, there's so many more things to discuss about this, and this is a really great opportunity for people to come out and talk to yourself and ask those questions that are a little bit that they might hesitate, to ask otherwise, and then possibly go for an evaluation.
Absolutely, yeah. The seminar is an opportunity for further education, presentation of information about the fundamental issues associated with urinary incontinence,
Right.
opportunity to talk and ask questions.
Well, we have that phone number on their screen, but you must pre-register for this event on the 22nd, 10:30 on Lake Drive. It's absolutely free, and it's a wonderful opportunity.
That's
for
right. Thanks,
people.
Dr. Hoekstra. I'm sure there are a lot of women in our audience who are sharing this information, and they're just relieved to know that, number one, they're not alone, and number two, there are some great treatments available. So thank you for sharing your time with us today.
Absolutely. Thank you for having me.
Stay with us. We'll be right back.
Are you West?